Today we are going to talk about the alveolar recruitment strategy, which is very effective in COVID-19 condition to improve their lung functioning. Now in alveolar recruitment strategy, we try to recruit the alveoli. What are these alveoli? Our lung is made up of millions and trillions of alveoli, and these alveoli are the smallest unit of the lung, which are the small air sacs which should remain open for the effective lung functioning. Now what happens in COVID-19 is that these alveoli, they collapse, which is called atelectasis. There's collapse and consolidation of these lung alveoli, and as a result, the lung cannot function properly. That is the reason we need to aim at the alveolar recruitment strategy. Through the alveolar recruitment strategy, we can recruit most of these alveoli and open up our lung, which will help to improve our lung volume, which will help to improve our lung capacity, and thereby we can come out of the COVID situation quite comfortably. For that, the first thing which we should be incorporating is the deep diaphragmatic exercise. In deep diaphragmatic exercise, we need to involve the diaphragm. Our diaphragm is the main respiratory muscle which separates the abdomen from the thorax. So for a deep diaphragmatic breathing, we inspire through our nostrils. We take a deep breath for almost 3 seconds. We try to hold it for 4 seconds and slowly release it through the pursed lips. For almost 6 seconds. That is, the expiration time should be double that of the inspiration time. By doing this, we are trying to procure 3 most important things. First thing is that we are trying to engage the diaphragm, which is the main respiratory muscle, for the effective lung functioning. Secondly, we are using pursed lips, by which we are able to reduce the work of breathing. We are able to reduce our respiratory rate. It not only helps to reduce our respiratory rate, it reduces our shortness of breath, it reduces our breathlessness, it reduces our anxiety as well as blood pressure. So that's the added benefit of pursed lip breathing, along with the breath holding strategy, which helps to open up the alveoli. So these 3 things should be taken care of while we are doing the deep diaphragmatic exercise, which should be practiced by each and every individual. Whether you are affected by COVID or you are not affected by COVID, we should keep our lung, our respiratory muscles strong by doing the deep diaphragmatic exercises, and we should try to do it every 1 or 2 hours whenever we are awake, and we can do it for 10 to 15 times at a stretch every time that we do.